Greg, TX Team has been around we're going into our 26th year as a history of our company.
Yeah.
How was the vision of coming up with TX Team? How did that first start with you?
Well, it's kind of funny. I was working for a company similar to mine and had worked there for 7 years and had seen some things that I liked and some things that I didn't like and what therapists were having to go through and what they were having to work with. And I thought, if I could start a company and really focus on unique care from the standpoint of the unique places that I focus on, I think we could really have a place where people could have the therapists would have a good opportunity to go and work and really enjoy what they do and enjoy the kind of clientele that they have.
So when you partnered with the facility, what kind of partners did you choose?
By far, it's not-for-profit, church-based nursing facilities. They have continuing care retirement facilities. I also like the hospitals, the acute care hospital setting, LTACs, which are long-term care health settings for patients that are too acute to go home or too acute to go to a nursing home but end up in a hospital setting.
You know, we started with just one area and have grown into all the different areas.
Yeah.
How have we grown into all the continuum of care that we have?
A lot of it was trial and error. I would get a client and they would be focused on one area. And as we would go into the process of growing, they realized that there were other areas that they needed to expand in as well. And with that, I wanted to be a partner in those areas. So not only did we just start out with physical therapy, we went to speech and occupational therapy. We've gotten into inpatient clinics, the outpatient clinics, inpatient, outpatient physical therapy in the hospital setting. It's all just been trial and error. It's just been really what has been demanded of me by the facility and the people that we've been able to work with. They've almost empowered me to help them expand their services.
Well, you say expand too, and we started in Indiana back in 1983.
Sure did.
However, over the past 25 years, we've grown further than that. And what do you feel about growing further than that outside of our home state?
I'm very comfortable with it because of the fact that we have such good people and good supportive people that we can really take a new grad and put them in a facility and provide them with the support that they would need to grow no matter what part of the country they're in. Currently, we're in Indiana, we're in Illinois, we're in Maryland and South Carolina. And those places are places that have really sought us out first. And then if we get into those particular areas, then we expand our services throughout that state and stay that way.
Along with the growth of our company, we've gone from, I think your original staff had 4 people working when we first started at TX Team. Now we're over 320 employees, or associates as we like to call them, our team members.
Well, I've always had a philosophy, and it goes back to my days when I was a young kid and I had an opportunity to go to the Dale Carnegie course, How to Win Friends and Influence People, and I was told then, if you help other people succeed, you will succeed far greater number of times than they ever will. And through that process, I've always said, if I can maintain good support and really, really help people succeed and do their thing, quote unquote, that they in turn would turn out to do a good service for TX Team, which they have done through the years. And my support staff, my president and vice presidents, they're all just unbelievable. Rehab directors are unbelievable. They're all therapists. They all understand the day-to-day operations of what goes on. We have numbers men when we need them, but we also know we have therapy. We're doing therapy, and when we do therapy, there's a human factor involved. That's always been important to me.